Hello, welcome, and good afternoon. We will be getting started with our Community Care Agency RFA webinar to share more about our application process and what the commitment entails. I am Christina Vestida Gonzalez. I am the Community Health Director at United Way of San Joaquin County. I am sharing my screen and hoping that you can follow along. Again, welcome for joining us this afternoon. A couple of housekeeping items. We're going to reserve some time at the end of the presentation for Q&A. We do kindly request that you reserve questions during that segment of the presentation. However, you are welcome to use the chat feature. If there is anything on your mind, be it a question or a comment, please feel free to drop it in the chat. We are also recording the session, so you're welcome to have your camera off, or if you would like for us to see your face, you're also welcome to turn your camera on. So going over the agenda, we'll do a brief overview of the Alliance for Wellness. Many of you joining the webinar today have heard of it in some shape or form. We have been socializing our community care hub model out to the community from our strategic planning on to where we find ourselves now in the thick of implementation. And then we will take a deep dive into the Community Care Agency RFA, where we'll go through some of the questions that we ask within the application, also highlight some of the documents that you will be asked to upload within the form, and we will also go through some of the training requirements for agencies that are awarded this grant. And then, as I mentioned, there will be time at the end. We'll reserve about 10 to 15 minutes for Q&A. And any questions that we don't get to respond to during this session, we will be sure to catalog both the recording and the questions and responses will be posted on our United Way website, that being unitedwaysjc.org, at the Alliance for Wellness landing page. So diving right in, the Alliance for Wellness is best described as a community care hub. Many of you are involved in health and social service sectors, may have heard of this term before. We are working to improve health outcomes through a community-centered care coordination model that addresses social determinants of health or social drivers of health, also described as health-related social needs, through community health workers. Qualified community-based nonprofit organizations will contract or subcontract, in this case, with the hub to deliver community-based care coordination services that align with not only California's CalAIM initiative to assure quality with Medi-Cal requirements as well as compliance, and utilize the Evidence-Based Pathways Community Hub Institute model. Again, more information can be found at our landing page. We do have a one-page description where you can read more about our model. Briefly here, with this Alliance for Wellness model, we're aiming to support subcontracted CBOs or community care agencies, as we like to call them, in a very diverse way. Part of it is that capacity building support, especially for CBOs who are interested in contracting for Medi-Cal. On one hand, there is a need to be stewarded through the process, the Medi-Cal certification process, but also ensuring that there is the appropriate monitoring and oversight mechanisms to assure quality and compliance. We've also heard from the community during our landscape assessment that has led to the formulation of the Alliance for Wellness is the need for billing infrastructure and administrative support on an ongoing basis. What we've realized as a collective is that submitting claims and making sure that reimbursements are received in a timely manner, it is a challenge and quite the administrative burden in of itself. We also administer the Connected Community Network CCN platform, which is a platform by Unite Us. And it is a closed loop referral platform that many agencies in our community across our county are utilizing. We want to leverage this infrastructure as it makes sense to help streamline referrals for community care and case management. Contracting or subcontracting through the hub, United Way, through the Alliance for Wellness, will help support requirements that are expected of you per Medi-Cal contracting, or specifically contracting with managed care plans in our service area. For those that are currently not very experienced with managed care contracting, we will work with you to ensure that care coordination and the appropriate operational workflows are in place so that you are rendering services compliantly. We'll also be working with subcontractors with data reporting requirements to ensure that health outcomes are being tracked so that any goals per an individualized care plan and beyond are being achieved. A huge element to this model is the community health worker centeredness. So we are committed to supporting the workforce development and continuous training for this essential worker. We are working very hard to establish a CHW association, leveraging the CHW network that has been led for the last few years via San Joaquin County Public Health Services. We recognize that there are CHWs that span the county that are in different settings of care or healthcare or social service sectors that we hope to engage. And so we are working very diligently to transform the CHW network into a CHW association across the service area. And then, of course, we expect to provide ongoing technical assistance for those Medi-Cal managed care plan contracts. And I would like to highlight a couple of things. You know, through this model, it is our goal to improve community health outcomes, not only through this contractual arrangement, but really strengthening the essential worker, that frontline role of CHWs. And so that commitment to the workforce and economic development is paramount. At the same time, we are in an ever-evolving healthcare landscape, as we know. And so we are top of mind following health policy very closely. We have a huge network to lean into. And so we align funding and health strategies so that we can sustain this work beyond its implementation. Now I will talk about the Community Care Agency RFA, beginning with its purpose. For those who may have not accessed the RFA in full just yet, we'll do a brief overview. We released that last Friday, July 18th. Please note the application deadline being August 15th by midnight Pacific time. The award is a value of $100,000. It is quite competitive as we are selecting a cohort of 5 CBOs at this time for a 12-month performance period. As we provided that overview of the Alliance for Wellness, we really aim to improve health outcomes by coordinating care and addressing social determinants of health through community health workers. There are a few target populations that we'd like to really hone in our efforts, and they include the justice involved, the birth equity population, as well as high utilizers of emergency and hospital care. Selected community care agencies, also described as CBO subcontractors, they'll employ CHWs, or, many of you already employ CHWs, which is a huge bonus. They're trained to navigate and close pathways addressing these health-related social needs. A few examples include supporting access to care, through benefits navigation, connecting them to employment and transportation support, housing through navigation, tenancy and sustaining services. So when you think about the Medi-Cal eligible services that you might already be rendering, we are talking about the community supports, the housing trio, medication screening, reconciliation, and adherence, asthma remediation, also a community support through qualified supplies and physical modifications. Now for, our communities that have chronic diseases or have a clinical need, we're supporting food access and security, especially for those who need a medically tailored meal. The eligibility for this RFA, we are looking for community-based nonprofits with experience in CHW programming, employing CHWs, and with operations in San Joaquin and or Stanislaus counties. The nonprofit should demonstrate readiness to provide CHW care coordination through existing service delivery and community-based programming experience. When you are accessing the application, you'll notice some of these questions are very focused around your CHW experience. Selected community care agencies must have the intent to subcontract with the Alliance for Wellness to provide Medi-Cal and use the PCHI model. Something to note, and we're happy to have an offline conversation depending on the nuance of your situation, that we are working very closely to support CBOs to contract with HealthNet, and we are capacity building, providing capacity building support to agencies to also support their contracting requirements for Health Plan of San Joaquin. So elevating those two that are present in our area, both HealthNet and Health Plan of San Joaquin. Part of this funding award, so the $100,000 for a 12-month period of performance will be based on the completion of several deliverables, staffing. So 25% of the award is related to staffing and contract execution. The contract execution being between the CBO and United Way of San Joaquin County. There are several training requirements, and we'll get to that in a moment. And then about half of the award is connected to outcome payments. So we want to make sure that, payments are tied to outcomes to ensure that true, risk mitigation or risk removal is happening for clients that are being served. And as we all know, contract negotiations are quite tedious. And so while we are engaged with those, with the managed care plans, that will be determined in the new year. But we are working towards the contracting with the managed care plans for ECM, community supports, and the CHW benefit. And so as you review the RFA, or just reflecting on the previous couple of slides, the different populations of focus, as well as some of the community supports that we're really focused on, are really key. And so as you apply, please be sure to uplift your experience working with those target populations, as well as with Medi-Cal eligible services per those community supports described beforehand. Now onto some of the training requirements. As this is a very CHW-centered model, we are looking for CHW certification. We are aware that many agencies have had their employees participate in the CSU Stanislaus CHW training program, which is great. Now, in the application process, you'll be able to notate whether your employees, employed CHWs, or prospective CHWs are certified, are expected to be certified, and we will work with you to ensure that certification requirement is met. Second, the PCHI model. It's a virtual training model that will help you become acquainted with that framework, some of the documentation that we'll have to do, especially for any home visitations, any referrals that are made. Again, having that documentation in place, that also satisfies Medi-Cal requirements. There's also Medi-Cal training. And through this, we'll help support the CBOs to obtain Medi-Cal certification if they don't already have it. We'll also support the subcontractors to maintain contractual compliance with managed care plans through our nonprofit capacity building program with a Medi-Cal track. So this is a specialized curriculum for the community care agencies. Part of your award waives the tuition. And I'll have a few more slides to kind of provide an overview of what that training looks like. But it's 4 days a month from January to April in the new year. And again, there are stipends for those that are recipients of this award. Now, we will also have participating community care agencies utilize the Connected Community Network, or CCN, for the closed loop referrals to support care coordination. We'll also work with you in the adoption of policies and procedures or their development, depending on where you are with your familiarity or programming as it relates to Medi-Cal contracting, and help streamline care coordination by equipping you with any administrative or technical support that you need along the way. So taking a deeper dive on the training requirement, especially the nonprofit capacity building program Medi-Cal track. So there are a couple of options. For those that have already completed the program in the past, you are welcome to apply for this upcoming cohort and notate that you're interested in the Medi-Cal track and that you have either submitted, depending on how far along you are with the application, or have the intent to submit the RFA. From the back end, we'll make sure that that's compatible, and therefore you will only be required to participate in the Medi-Cal track and not in the full program. So you would be doing 2 days a month versus 4. Now, if you are a new participant and you have never engaged in the nonprofit capacity building program, we invite you to apply. The expectation is that you do complete the full program. And so this is where the 4 days a month for the Medi-Cal, that's about a 2 to 3 hour commitment. For the nonprofit capacity building program, the hours are a little longer. I invite you to register for the nonprofit capacity building information session being held on August 5th from 5 to 6 p.m. via Zoom. You can scan the QR code, and we'll take a minute for anyone who'd like to scan the QR code and open that up, or you're welcome to visit our website. Again, that is unitedwaysjc.org, and you'll be able to toggle into the nonprofit capacity building program landing page to pull up the event flyer or the information session flyer. I did want to spend a little bit of time talking about the Medi-Cal curriculum. So these are the overarching topics that we'll be diving into. So for those that are new to the Medi-Cal space, we will sort of have a level set session where we have a Medi-Cal 101. So this is really understanding, what is Medi-Cal, and the opportunity through your involvement in eventual contracting. We'll also provide a session on navigating claims and billing, really understanding some of those codes, how to best complete claims, what information are they looking for, how are they looking for it, so that, again, submissions are processed in a timely manner, you're avoiding delays and/or denials. We'll also be going through community care coordination. What does that mean? Many of you are very experienced in this already, but we'll be tying it back to the framework we are using. We'll also have a session where we talk about the integration of behavioral and social services within the more traditional healthcare service delivery model. Part of this may be redundant to our very seasoned participants, but it'll be good information nonetheless. As mentioned, closed loop referrals will be going through that. For those that are already experienced with the platform, this will be a great refresher. And for newer agencies still navigating through the platform, you'll feel very confident utilizing it. We'll also work with you to track health outcomes so that we can leverage the data to help you and your agency access other resources beyond our agreement. And really important, in the context of Medi-Cal contracting, we'll work with you to develop a quality improvement framework. For those that might already be contracted with one managed care plan, if not both, usually 2 years down the road, there's an auditing process. And so to make sure you're best equipped and have a quality improvement plan and framework at the ready. We'll also work with you on, just client engagement and empowerment strategies that will really help for effective outreach and member engagement. So for the application materials, there are a few attachments that you'll need to upload that we recommend you have at the ready. The application itself does not save, so it might be helpful to answer some of the questions on a separate document, whether it's a Word doc or what have you, and then have your attachments ready for upload. So some of those attachments is your IRS determination letter, your state or local business license, liability insurance policy. For the insurance policy, it's if you have it. Through our subcontracting relationship, we are also extending liability insurance. But if you have it, please upload it. And then we are also asking for 2 letters of support. One letter should be from your board. This could be your board chair, or it could have your entire board, as long as there is your chair represented and they are indicating that they have approved pursuit of this opportunity. That will be helpful. And then second, a letter from a community partner to demonstrate, your the experience and satisfaction in the community health programming efforts that your organization has embarked on or has experience with. Here in front of you, I have provided the link to the application as well as a QR code. Following this session, we will be sending this out to everyone who is here today, as well as putting it on our landing page on our website. So again, you're welcome to visit our website at unitedwaysjc.org, find the Alliance for Wellness tab, click on there, and you'll have the application available to you. Now, we will engage in Q&A. And so you're welcome to either raise your hand or I will be reading through the chat if there are any questions. You're welcome to go off mute as well.
Hi, this is Shauna with the Child Abuse Prevention Council. So are we considered a larger agency? And I know we are doing our own Medi-Cal certification. So would this not be a good fit for us, or how do you see that fitting in?
Yeah, it really does depend on the situation. And again, depending on where things are, we can connect one-on-one. But essentially, we are here to support us, community-based nonprofits, especially the small to mid-sized one, and support you through contracting negotiations, through billing and what have you. If your agency feels, they've got it and maybe they just need some help with billing, we're happy to have that conversation, but that would look like a very different arrangement. Um, at this time, based off of where our conversations are and the feedback that we've received from the managed care plans, that being HealthNet and Health Plan of San Joaquin, their contracting arrangements are a little differently. So for those who are contracted already with Health Plan, you would maintain that contract and we would just support that administrative capacity build out for your agency and provide any technical assistance in a continuous manner. So it really does depend on where you are in terms of your implementation progress, or maybe your experience with auditing, and you're like, hey, I would much rather contract through a hub versus contracting directly. So these are some things that, you know, um, as you review the RFA can evaluate to see if the fit it's a good fit for your agency.
Hi, this is Carrie Grover from Tracy Community Connection Center. Um, so it's my understanding that in order to bill for CHW services, that you have to have a licensed, um, I don't know if it's RN or LCSW or somebody on
There's a
staff.
right, yeah, there's a qualifying license provider.
Hmm.
Hmm.
And
Yeah,
would the United Way provide that, or would we have to have that person on staff here?
so it would work through a couple of ways. One, through like a co-located partnership that we broker um, with a qualified licensed professional. On the other hand, depending on whether that client's already engaged in care, it can be a referral from their provider. Um, and I did want to also clarify that while it's very CHW centered, the CHWs will be rendering services that are applicable to billing across three benefits. And so we'll be working with the subcontractors to identify when it's appropriate to bill for, you know, the ECM or community supports, or if it defaults to a CHW.
Okay, so if we, for example, we're already contracted with Health Plan and HealthNet to do the housing trio. And
Mhm.
if we were looking to expand into, like, say, ECM, would that be a fit for this or no?
It would be, but something to consider is that if you are already contracted with HealthNet, you would have to relinquish your direct contract and some
Oh,
contract through the hub, and we'd hold the contract. So,
okay.
definitely assess whether that's a fit or not. In the case of Health Plan of San Joaquin, you can maintain your direct contract.
Okay. But in terms of, like, I'm not contracted for ECM with either, but we would
Gotcha.
still have to relinquish our HealthNet contract for our housing trio, or could we just do the ECM?
I think it would depend, and I think we would have
Okay.
to have, a separate conversation to really tease
Okay.
out the nuance of your circumstances.
Okay. Thank
Okay.
you.
Yeah, no problem.
I'm sorry, Christina, can you repeat that again, what you just said about the relinquishing of the contract part?
Yeah, so for those that are pursuing this opportunity, for those that are interested in, if you're already contracted with HealthNet, um, this may or may not be a fit depending on the agency's comfort with relinquishing a direct contract. So this would be more applicable to HealthNet contracting, where if you are contracted with HealthNet, but would like to subcontract with us, that does require that you relinquish that contract, and instead it would be an indirect contract with the managed care plan. What that does, not to get too into the weeds, but when you do a subcontracting, and in this case through our model, does remove risk and liability from the CBO, and that is assumed by United Way of San Joaquin County. So in this case, that path is appealing to smaller CBOs who just um, aren't comfortable or also don't have the resources to assume that risk, if that's helpful.
I have another question. And
Sure.
maybe this is more appropriate for the informational setting about the nonprofit capacity program, but would we, in theory, like let's say we decide this isn't a fit for our agency because we don't want to relinquish our health
Mhm.
net whatever, would we still be eligible to send a staff member to the Medi-Cal track? Or do you have to be doing this contract in order to do that?
Yeah, you're welcome to participate in the Medi-Cal track. We will be limiting space. If your agency has already participated, you can still access the Medi-Cal track and that curriculum in totality. However, there is a cost associated with it, which is the general NCBP
Okay.
cost. So we're pretty much keeping it very consistent.
Okay.
For those that are awarded, you know, receive this CCA award, their cost is covered.
Okay.
Mhm.
Great. Because I think that might be a good resource
Yeah,
for a couple of my staff members who
yeah.
are kind of new to Medi-Cal.
Mhm.
So I'll go to that session and ask more there. Thanks.
Yeah, yeah. And so at that session, it'll be myself and our Chief Operating Officer, Jose Serrano, who has provided oversight to that program the last going on 4 years.
Perfect. Thanks.
Mhm. Are there any additional questions at this time? You're also welcome to drop questions in the chat, or you're welcome to email me. And I will drop my email in the chat. I don't think I put it on this presentation, so I'll do that right now. And again, if you go to our landing page on our website, you'll be able to access my information as well. But here you go in the chat, just so you have it on hand. And as questions come in, either now or at a later point, we'll be updating the Q&A section on our website. So you're always welcome to go onto our Alliance for Wellness landing page to have any questions that you have answered. Again, welcome you to also send me an email, and I will get connected to you as soon as possible. Last call for any questions. Again, let's stay connected. You know where to find us. And then I also dropped my email address in the chat, and you can find it on our Alliance for Wellness landing page. If you're not already, please follow us on social media for more information. Thank you for your time today, and happy to give you back 30 minutes.